Hello guys, this is Jonathan Munoz, and today I want to talk to you about this question: what has more weight, an in-person interview or a virtual observership, virtual rotation? And bottom line is that we will continue doing virtual observerships and virtual interviews for the next 2 years at the very least, because not many programs will be able to change back, and a lot of these programs have found that they like this ability to be able to interview more and more people. So in terms of the USCE, which one has more weight? It will depend. It will depend on, of course, where you're doing the observership or the virtual observership, and most importantly, what are you getting to learn from this observership? Because remember, even if it's 1-2 months, at the time of the interview, when the interviewers go through your personal statement and through your ERA CV, and they see this or such clinical experience in the United States, they will ask you, why did you do this observership in infectious disease? Or why did you do this observership in outpatient family practice? And the answer to this question could be the one that breaks you in or out of the game. So let's just put an example, and you did an observership, a virtual observership in infectious disease at the University of Miami. Let's say that I just like the university so much because I did my observerships there. So let's say you did a virtual observership in infectious disease, and because this program, this observership, is so well structured and has so many areas that you will be evaluated on, you will learn something specific about the observership. For example, in infectious disease, what is important on infectious disease? For a resident, for a future resident, for a medical student, what is important? Is it important for you to be able to, diagnose a weird infection disease? No, because everyone can do that. At some point, you will be able to do that. The expectation is that as an intern, you are able to at least manage antibiotics. So you're not expected to do big management or big identification of diseases, but the basics. So let's say you did this infectious disease observership, and at the time of the interview, they ask you, so why did you do this observership? And you honestly, in all honesty, you say, well, because at the end of my medical education in my country, I thought I was lacking on antibiotic management and proper selection of antibiotics. So I wanted to see how was the process and what was the proper course to de-escalate or escalate antibiotic management in hospitalized patients. So this answer is very important because in the United States, we have this, every hospital has an infection disease or antibiotic stewardship program, where any patient that is admitted on day one with vancomycin sosine as a default antibiotic therapy gets to be seen by an infectious disease specialist who rapidly tries to de-escalate this broad spectrum combination to something more specific, let's say ceftriaxone, and later oral Keflex, but based on clinical reasoning that is properly documented on the medical note. So, and the word to this is antibiotic stewardship. So, if you're able to say that this is what you learn, so you answer the question of why did you do an infectious disease observership? Okay, now what did you learn during this observership? And you say something in the lines of, well, I feel more reassured on the knowledge I have on antibiotic management. I think that it's important for a fresh intern to be able to narrow the therapeutic options for every case of infections that we can see, and in order to prevent C. difficile infections, colitis, in order to prevent overuse of antibiotics and resistance. So that will be an ideal answer, and that will be an answer probably that puts you in the spot to be considered for residency. Why? Because it has a lot of perspective. It has a lot of substance, and it's important for a program director to know that you know all this. Okay, so let's say that that's the best answer you could give for this rotation, this virtual observership. And now let's go to the other aspect. Let's say you did 1 month of family medicine in-person outpatient clinic, which is one of the most popular rotations there are. Internal medicine or family practice done by an outpatient doctor that doesn't have university affiliation, that doesn't have any relationship with residency programs, but offered you an observership for $500, $1,000, and you were able to make it to the United States and do the rotation. But because this doctor doesn't want you to slow him down, he put you on to follow him in clinic 4 days a week, 3 hours a day, and what you were doing was basically standing behind him, discussing some cases, but most of the cases that come to clinic are I don't know, coughs, abdominal pain, back pains, refills of medications. And because there was a lack of motivation to teach, there was a lack of motivation to learn. So you really didn't have much guidance. You didn't really focus on what should be learned in an outpatient rotation. So at the time that they ask you, why did you do family medicine rotation? Then your answer could be good to that one. You could say, because family medicine or internal medicine are the cornerstone of medicine, and learning good history taking and physical exam are essential to a new intern. Yeah, and then they ask you, so what did you learn in this rotation? And you make the biggest mistake that everyone makes, saying, oh, a patient came with a very bad EKG, and I knew this was an aortic dissection, so I sent him to the ER, and later he came, a month later he came, and he thanked me for saving his life. So that's not what you have to take as a key point out of 1 month of an observership in internal medicine or family medicine. And that's the mistake that many make. So this, in essence, this is the point of this talk, is that it doesn't really matter if you did a virtual observership or an in-person observership. At the end, what it will matter is, at the time of the interview, what did you learn? And if what you learn, it's important to the specialty you're applying to: internal medicine, family practice, pediatrics. So you can do a rotation in pathology if this is the only thing you were able to secure. But as long as you ask someone that knows the process of interviewing, how could you find a relationship between pathology and internal medicine to make this rotation meaningful? Any rotation can be meaningful to internal medicine and to family practice. Let's say dermatology, endocrinology, rheumatology, all of them. You just have to find the right angle. And this is not lying. This is really getting to know what is important for a primary care specialty. So that's my 2 cents on this question. If you're in a financial constraint and you're not able to pay for an in-person rotation and come here, pay for your stay, pay for your flights, then I would say go for what you have at hand. Go for an observership, a virtual observership, and do the best on that one. Take 2 of them, do 2 of them, 3 of them for the price of 1 in person, and you will be fine. This year, I'm very happy to say that I had so many applicants that did virtual observerships that they match, and they did well with 1 or 2 virtual observerships. And the way I'm seeing this, for the next 2 years, we will be fine with virtual observerships and virtual interviews. So this is all I have to say for today. Hopefully it helps you on calming down a little bit on the nervousness that comes with all this application, and to be able to manage the funds that you have, to be able to manage the time that you have. So go for it if you can, and send requests for questions if you have any.